Okay, so get this right. The other day, I'm going through some files, and I come across notes from a session, must have been like a year ago. And honestly, I could barely read my own handwriting. It was like deciphering some ancient scroll.
Oh, tell me about it. We've all been there.
Right. And it kind of hit me then, good notes, like really good notes, they're not just about, remembering what happened a year ago. It's about doing our jobs well. So in this deep dive, we're tackling note-taking, but specifically for us mental health clinicians.
Absolutely. It's way more than people realize.
But we're not just talking about checking those legal and ethical boxes, although those are important. We're going way beyond that. We're exploring how the right note-taking practices can actually make you a better clinician.
100%. It's about upping your whole game.
Exactly. And I've got just the person to help us unpack all of this. Welcome to the show.
It's great to be here.
When we talk about notes being more than you think, what comes to mind for you?
Well, yeah, you've got the obvious stuff, right? Like the legal protection, keeping track of client history, all that. But I think where a lot of clinicians have that aha moment is when they realize just how crucial their notes are for risk management.
Risk management, yeah, that often gets overlooked. Can you give us an example of what that looks like in practice?
Absolutely. Okay, so let's say you're in a session and a client starts sharing some concerning thoughts, maybe about self-harm. Now, a very basic note might just say, client expressed feelings of hopelessness, but a note that's really focused on risk management. That note's going to document the specific statements they made, your assessment of the situation, what interventions you used right there in the session, and what your safety plan is moving forward. That's how you cover yourself.
Wow, that's a powerful example. It's not just about remembering what happened. It's about creating this clear record of your clinical decision-making process.
Exactly.
You've got it. And on, maybe more positive note,
Yeah.
we can't forget about how important notes are for ensuring continuity of care.
Oh, for sure, for sure.
And it's easy to think about that when a client's, transitioning to a new therapist.
Right, handing off the case.
But you're right, there's more to it than that.
There is. Think about even when a client's finishing therapy, termination. You want those notes to show their progress, yeah. But also any challenges that are still there, recommendations for the future. Your notes, they can be like a bridge to help them navigate life after they're done with active therapy. And even, maybe guide another mental health professional down the line if they need one.
It's like creating a roadmap for their well-being, even after they've left your care.
Precisely.
And here's something I don't think gets talked about enough. The way we take notes, it can actually impact our treatment decisions. It's easy to get caught up in the session itself as it's happening.
Right, you're in the thick of it.
But when you regularly review your notes later,
It's like a whole other level of insight.
you might see patterns you wouldn't have otherwise.
Absolutely, all the time.
I've definitely had those moments where I'm going back through notes and I'm like, oh, wow, there's a recurring theme in their behavior, in their thought process that I didn't even fully pick up on in the moment.
It happens. The notes reveal it.
Exactly.
Huh.
So they're not just a record of the past. They become a tool for actively shaping your approach to therapy, which is really cool when you think about it.
It's like having that extra set of eyes, helping you be even sharper.
Okay, so we've established that good notes are super important. But I think the big question for a lot of us, and I'm putting myself in this camp too, is how do we actually make that happen? Because let's be real, our practices are busy. We're juggling sessions, paperwork, maybe trying to sneak in a lunch break.
You're telling me it's a lot. It's all about finding a system, a workflow that actually works for you. And the source we looked at, it had some good advice there. It really emphasized making note-taking a part of your natural flow throughout the day, not
Yeah.
the separate, big, scary task.
So instead of waiting to the very end of the day when you're mentally fried, you're squeezing it in, you're saying maybe jot down a few key points right after each session while it's fresh.
Exactly. Or some people, they do voice recordings, quick and dirty, then go back and clean it up later. It's about finding those little pockets of time. And honestly, using technology to your advantage.
Speaking of technology, should we talk about the kind of elephant in the room here? Because this isn't your grandma's notepad anymore, right?
Right.
AI is changing the game when it comes to note-taking, and it is happening
Okay.
fast.
Oh yeah, that's the future docking. Or maybe it's already here.
Right. And I'm not going to lie, I kind of geek out about this stuff. I've actually started experimenting with AI note-taking, and it's It's pretty mind-blowing what it can do.
It really is. I mean, even just looking at what's out there, our sources mention Upheal, Heidi, Nirvana, even Otter.ai is getting in on this. It's like every week there's a new one popping up.
I know, right? And what's interesting to me is they all have their own, like, specialties. Like, Upheal, it's designed specifically for mental health, right? So it's got all these features tailored to our needs, but then you've got something like Otter.ai, which is more of a general transcription tool, but it can still be super helpful for just capturing that initial raw data from a session.
It's like having a whole toolbox full of different AI-powered options.
Yes, exactly. Like, I notice, Heidi, it's all about voice commands, which, come on, that's a game changer for anyone who hates typing, which I think is a lot of us. Imagine just dictating your notes directly into your system.
That's the dream. Although I do have to throw in a little word of caution here.
Oh, absolutely.
Anytime we're using new technology, but especially when we're talking about something as sensitive as client information,
Data privacy is huge.
huge. We have to be so careful about protecting that information. I mean, before you even think about trying one of these programs out, research the company. What are their policies on data privacy? What security measures do they have in place? What are the potential risks?
Yeah, and I think it goes beyond just the data privacy piece. At the end of the day, we have to remember AI is a tool. It's not a replacement for our clinical judgment.
100%. We can't let it do our thinking for us.
That human touch, that intuition we bring to the table. AI can't replicate that,
At least not yet.
right? Who knows what the future holds? Okay, so we've got these cool new AI tools, but we can't forget about the workhorse of many practices, the EHR, the electronic health records system.
Yes, the EHR. Not always the most glamorous topic, but definitely relevant here.
Definitely. And they're becoming more sophisticated all the time.
That they are. I mean, our sources mentioned how some EHR systems are even starting to integrate AI features now, which is pretty wild.
Right. Like, just imagine for a second, a world where your note-taking software, it's talking to your scheduling system, which is talking to your billing system. It's all seamless.
Oh, the streamlining. Talk about a dream.
Right. It could free up so much time and mental energy for what truly matters, our clients.
And at the end of the day, isn't that what it's all about?
Absolutely.
I mean, I think for a lot of us, time is the biggest barrier to good notes.
Oh, without a doubt.
But with the right tools, the right strategies, it doesn't have to be this constant uphill battle. It can actually, flow.
That's a beautiful thought. And I think it's a perfect place to kind of transition into our next segment, because we've covered a lot of ground here. We talked about why good notes are so essential, the how-to of making it happen, and even got a little glimpse into the future's now of AI note-taking.
And we're just getting started.
Exactly. So much more to explore. But before we go any further, I want to pause for a second and bring it back to you listening.
I love it when you do that.
Well, it's one thing, just one tangible thing you can do this week to level up your own note-taking game. Just something small to get you started.
Maybe something that really resonated with you in this conversation so far.
Totally. Maybe you're going to try out that voice recording app during a session, finally give that SOP format a real shot. Or maybe you're feeling really adventurous and you're going to book a demo with one of those AI programs just to see what all the buzz is about.
See what all the hype is about. I love it.
Dip your toes into the future of note-taking, why not? But most importantly, remember, it's about finding what works best for you, for your style, your practice. So you can focus on providing the best possible care for your clients.
Couldn't have said it better myself.
Until next time, everyone.